A warm welcome to you from Geneva, Switzerland. So this is the 14th experience sharing session in English in the Movement for Immunization Agenda 2030. We're here with Dr. François Gasse. François, how are you doing?
Hi, very well, Rida. Thank you very much. I'm looking forward to hear an experience and the sharing, and because this is always useful to get the field experience directly. It's always a learning session. Thank you to you, Rida.
Thanks, François. All right. We have certainly more people who are going to be joining. So I'm just going to remind you the task at hand for members of the movement of IA2030, which is to develop your Immunization Agenda 2030 Action Plan. So let me quickly go through what that, what that looks like. You've received a personalized link. So here's my personal inbox, and you should have received. So I received both English and French, but here, personal invitation to contribute. And this big blue link, click here to develop your action plan, is really the core of what you're looking for. So if you haven't yet developed your action plan or figured out how it works, it really is that simple. Anytime you see a blue link, click on it and see where it leads. Make sure you have a good connection so you can access all of the resources that we share. So anytime you see something blue that is underlined, so in my case, I'm going to click here to develop my action plan, and that will open up this screen. Now what you need to understand is that you have to do it in one sitting. You cannot answer some questions, take a break, save it, and come back. So you do have to do it from start to finish. For that reason, which is just a technical limitation, we hope to solve that in the future, but right now that is a limitation we have to live with. We have shared with you in the same email. You'll see there is there's an attachment. Where is the attachment? Yeah, here. Actually, let me just, here. There's an attachment, which is actually the full questionnaire for the action plan in a Word document. This is not so you can fill it in here and send it to us. We won't accept action plans by email. But this is so you can think through the questions so that when you go online to complete this in one sitting, you can actually do that. One important thing, the first thing we ask you, if we have an email address for you, you will see it here. This is the only email that we will recognize you with. So don't use multiple emails. It's always a bit complicated. And then if you are already a member of the movement, so you completed the detailed application for the movement, you will be you've received the personalized link now to skip these questions, but they're quick. A lot of them are just yes, no, and then some multiple choice items. So even if you have to go through them again, please do that to make sure that you can complete the action plan. It shouldn't take you more than a few minutes, even if it's repetitive and kind of annoying to have to go through these questions again. But you have now received the personalized link to go through that. And I see we are a much smaller group than we were on Tuesday, even though, and that is actually, in my perspective, a good thing. It means we can work as a small group, really on to give everyone time to speak and everyone to share, or more people, more individuals to share their experience. So we'll be going to the 30-minute mark, and then, if and only if the group decides to pursue the discussion, we'll mark a pause. It's a kind of a symbolic gesture or ritual that we go through each time. At the 30-minute mark, we'll ask you, should we extend the session? And if we run out of things to say, or if no one else wants to speak, then we end at the 30-minute mark. Otherwise, François has kindly agreed to extend his the time he spends with us, and so have I. So the first thing we'll need is a volunteer to share their action plan. So to really start with, going through the questions, which we've summarized here on your priority challenge, your corrective action. In this case, on Monday, we asked you for just one. In the experience sharing sessions, we'd like you to share, to summarize all three. and then to give us a sense of which indicators are important in your context. Once we've had at least one, maybe two volunteers do that, then we'll open up and ask you to share your experience. And that we ask you to share your professional experience, something you actually did, observed, not an idea that you have in this context. And then you need to ensure before you share your experience that you're convinced you are sharing, you're going to share it because you believe it is going to help your colleague. So those are the parameters. So the first thing we need is the first volunteer. So please use the raised hand feature, or because we are and it's a good thing. Fortunately, we are a small group. So do simply unmute yourself if you would like to be the first one to summarize your action plan. And you can summarize your action plan even if you haven't yet completed the action plan. So we'll mark a pause here. If no one volunteers, we will end the session early. With François, we make time to offer, and Charlotte, we make time to offer these sessions to support you, and yes, that depends entirely on you. So do we have a volunteer who would like to share their action plan so we can then begin the sharing of experience? Okay, let's go to Hawwa Buhari.
Okay. Good morning, colleagues. Good morning, Reda.
Good morning. We get you loud and clear. Yeah. Do you want to start?
Okay. Okay, I'm actually on the field, so you might be hearing some background noise. Sorry for that. Okay. Based on, I actually tried to do this yesterday. So I have my priority challenge for this is reaching the zero dose in both accessible and inaccessible, that's the hard to reach communities.
So Hawwa, can you remind us first where you work, what you do?
Oh, sorry, I'm Hawwa Buhari from Sokoto State, Nigeria. Hello?
Yes, we can hear you.
Okay, I'm Hawwa Buhari from Sokoto State, Nigeria. I work under the UNICEF Social and Behavior Change, Communication Change, and under the UNICEF project. So one of the priority challenges I chose for my action plan is reaching the zero dose communities, both in accessible and inaccessible communities. Why I chose the accessible and inaccessible communities, because in my state, we have both a mix of the urban and rural areas. So even in the urban centers where you have facilities close by, you still find a couple of zero doses in between. So reaching those is even kind of more difficult than that of the hard to reach communities. Then my objective, sorry, I'm trying to go through this through my phone actually. Okay, so the questions, actually my questions here kind of differ from yours because probably I failed in the initial ones. Hello, Reda?
Yes, we can hear you.
Okay. I mean, so I'll just go through what I have.
Yes, please.
Okay. Then it asks in one sentence, I should summarize my challenge, which I said my challenge is how to reach the children now across both communities. I want to find out why we have more of the of zero doses and why they never received the vaccinations in the first place, and then provide possible interventions on how to reach those children. I was being asked, is it too broad or general or vague? Then it's a specific action that I would want to take. Then I've been asked for which of the priorities I would take. I took SP3, which is coverage and equity.
Yep.
Okay. Then I was asked key area of focus, which I chose gender responsive strategies. So my reason for choosing this actually is because of the context in my community. We have a lot of gender-related barriers, which to an extent contributes to a high number of zero doses. Then I was asked, is my challenge related to any of following a list of questions? Yes, it has to do with measles outbreak, adult and children missing their in vaccinations, COVID-19 vaccination, disruptions in the campaigns, routine immunization, then introduction of new vaccines. I chose that because yes, we had a lot of issues while introducing the COVID-19 vaccinations. And even before COVID-19, when we have other antigens, for example, let me use the polio antigen here. We have various versions of it. We have, even in the oral poll, you have the MOPV, you have the BOPV. So because of the CVDPV outbreaks we've been having constantly recently, the NOPV, that's the novel version, was introduced. But we had to strategically introduce it to the community because of we didn't want the community to have that setback in acceptance. So then reaching zero dose children and missed communities, then other outbreaks which we have, sometimes we experience yellow fever and such, then malaria and other outbreaks. Then I was asked, now to tackle my challenge, I should define a goal, which my input was, my goal is to improve vaccine accessibility to zero dose population across our communities using gender responsive strategies. Why is my goal important? I feel if I achieve this goal, a good number of the zero dose children and adults in our region will be lowered. Then we will experience lesser outbreak of vaccine preventable diseases in our communities, and then attain a status of herd immunity, sorry.
Hawwa Buhari, can I stop
Yeah.
you? Can I interrupt you here? Because I'd like to ask François to give you feedback on his feedback and his suggestions, maybe recommendations on what you've formulated so far. So how you've gone from the priority challenge to the to the goal. François, what are your thoughts so far? What would you suggest or recommend to Hawwa?
I think I want to thank you for choosing such a goal, because obviously the outbreak, the list of outbreaks that you mentioned and the problem facing are linked to inaccessible population or people who don't use the service available. So I think one thing for your objective is to, maybe what we would like to know is, what is your current coverage figure? What percentage of children are not receiving the first dose of vaccine like Penta-1 in your area? And do you have a dropout between the first dose and the measles dose? What's the measles coverage? Can you, because this will be very important to support your priority challenge and the action you're going to take. Do you have some evidence?
I have some of them based on the DHIS, but I've not actually gotten that those not received who have not accepted first dose at all. But I have, based on the questionnaires, I have that of the Penta coverage, the Penta 3 and measles coverage.
Yes.
But yes, I will be able to get this. I should be able to get this. So
this would be very important to support your objective, because your action will take time, effort from your part and your colleagues, your partners in that effort. And I think someone is responsible, you're in charge in your area, will be happy to support you when he sees the magnitude of the problem you try to address and correct.
Okay, thank you so much, sir.
Thank you, François. So yeah, just to clarify, Hawwa, is this something where you're already taking actions, or is this a new challenge really that you've identified in the context of the movement?
We've done something on that initially, but we didn't really look at it as a bigger picture until I've been on the movement and I see how really important the zero dose communities are. Then based on some of the experience sharing we've had from our colleagues, on the movement. I've seen sometimes how they tackle their own issues of zero doses. And this idea actually came to me during some of our sessions. During our polio outbreak campaigns, we have like a line list of of families that are hesitant to collect the vaccination. But when we come to routine immunization or other campaigns, we don't have that line list. And during the polio campaign, this line list actually helped us to reach those families or those children who have not been vaccinated. Either maybe they either haven't collected any of the doses, or maybe they collected a few then dropped out at some point. So I felt if we have, for example, a line list like that of the polio campaign, it should be able to help us target directly down to the caregiver or to the child, to be able to reach. Especially this concept will be most effective in the urban centers where we have a mix of the zero dose in between those that have been vaccinated. Unlike, let's say, the hard to reach communities where you find them in a cluster, probably they've not been reached for one reason or the other, either through reasons of insecurity, some of the hazards or something like that. But within the urban center here, we experience, okay, either one or two things. It's either they are actually hesitating or there's some form of gender related barrier, or one thing or the other. So based on my plan for the action, we have we plan to organize a kind of focus group discussions with specific
So hang on,
caregivers.
before you tell us about the actions, Hawwa, so when you say we are planning to organize, who's we? Tell us about your stakeholders, because that's, as you know, and for everyone else, just to explain what Hawwa has done is, Hawwa Buhari, you have gone through the action plan questionnaire and you have actually completed your action plan. And you received it by email, you're sharing back to us. I think it would be useful for those of you in the room or watching the recording who have not yet done the action plan, to see how easy it is. It's really answering the questions. And again, Hawwa, what I really appreciate too, and that's important, is that I can hear that you are doing this for your needs, for something that you want to do. This is not like doing a course project or something for the course. This is something that is going to help you. So can you tell us more about your stakeholders briefly, because we do need to, there are many questions. François, we discussed whether the indicators should come first. So François made an important point. Even though in the action plan questionnaire, the indicators come last, you really should think about and consider them, because how else are you going to show that you're actually reaching children that were previously unreached, for example? So back to you to tell us about stakeholders.
Okay. Some of the stakeholders we work with, I work under UNICEF, but we have support from WHO, we have support from CDC, and we have support from the states, the government itself. So when I say the government here, we have it broken down from the local government to the districts, and then to sub-district levels. So down to the community level, we have some form of representation. Down at the community level, we have what we call the volunteer community network, who are actually mobilizers, and then they have their supervisors to support us at the community level. Then we have some of the traditional leaders at the community also among our stakeholders.
The next question is, do you need additional funding to achieve your goal?
Yeah, because okay, here maybe I might seem a little bit too ambitious, because apart from the FGDs, we're actually already kind of rolling out the FGDs, but we're thinking there's a kind of a survey here that I wanted to conduct, which for now it's being planned just within areas where we have people that can actually conduct it, because we don't have financial funding here to do that. Reason being that for the survey here, it's going to be much broader than the focus group discussion, because we're opening up feedback from not just immunization, because nutrition has to contribute into the immunization status and all that. So we went through nutrition, some form of education, and trying to integrate all sections of the UNICEF project into the survey. So here, from the questions, it's asked how much time do I need to achieve the goal. I indicated 7 to 12 months before that for the survey to be able to, for me to get the survey done, the feedback, and then find out actually the root cause of what we need, then the interventions roll out. But from the FGDs, it's doable within the 4 weeks stated goal and time frame.
Yep. So now can you tell us what are the three, can you summarize? So just list the 3 corrective actions that you've you identified for your action plan.
Okay, the first action is finding out the reasons why the zero dose communities are not accessing vaccinations. The second one is obtaining a line list of the zero dose children, just like we have done with the polio campaign, to have specific target audience to reach. Then the third action here is identifying a gender responsive strategy to help us tackle issues around the zero dose in both in routine immunization and other vaccine preventable diseases.
Yep.
Those are actions that we actually indicate for us to take.
Yeah. And how can you give us feedback as you went through the questions? Did anything surprise you? Did you discover things that you hadn't thought of? Did answering all these questions, was that actually helpful to you, or did it seem like a tedious administrative duty? Did you learn anything by being asked all of these very structured step-by-step questions to help you think through your plan?
Yeah, okay. Just like you indicated, though, there's a Word document attached, which from the situation analysis, we had something like that, which guided us. It actually helped the answering of the question. So I actually went through that to see what information or data I already have and what new data I would need to answer the questions. So I did that, which made it easier for me to answer the questions in one sitting. And well, something interesting I would indicate from the questions is that from compared to the situation analysis, which for the indicators here came at the ending of the questions too, I just had this thing in mind. Okay, I realized I need to, on a more regular basis, try to find out my coverage, because the coverages can change with, let's say, is it weekly based on the data collected on the DHIS and all that? Because based on my situation analysis and this question here, for example, let me give example of the COVID coverage. During the situation analysis, it was the first dose COVID coverage was 12%. But now when I checked it again as of yesterday, it's 18%. Then that's for the first dose, and then the fully vaccinated we have like 15%. So it's giving me like added info. I need to, on a more regular basis, try to check on the data and see what our coverages are looking like. So I think it's it's just like you said, even though it's not supposed to be like an educational setting, but it is educating, because you feed yourself with so much information, which on a normal day you might not go into looking into. So it's more, and it's shorter. The questions are actually shorter than the situation analysis question, which were like almost 100. So these ones were like, I think 28 or 38. So yeah, fair. It's fair.
Yeah, this is, yes, and I want to share my appreciation for all the members of the movement who joined in March and who completed, who answered the 95 initial questions. To explain why we asked you all those questions, many of the questions were questions that are being discussed at the global level. But in those global level discussions, people who deliver vaccines, people who work in immunization in countries typically are not part of the discussion. So the reason we ask you all these questions is to then share what you share with us with global partners, and also to help us design the full learning cycle to really help meet your needs. So just to finish before we open up for the experience sharing. So and we'll go to François first and then open up. So if you have specific experience that you think will help Hawwa Buhari with respect to her priority challenge, her goal and her corrective actions, or some combination of those three things, then please raise your hand. It needs to be helpful to her. She will tell us if what she hears has been helpful. Just to finish going through the questionnaire, we realize we ask you for 3 actions, just, we need to stop somewhere, but we can also ask you a broader question, what else needs to happen so you can meet your goal? We ask you if you want to share experience, which is actually what we do on Tuesday and Thursday with François Gasse and Charlotte Mbuh. We share the information on sign up here. And then we ask you about the indicators. So, first of all, you tell us what is the organizational unit or area of intervention, what system level and so on, what type of environment it is, the size of the vaccination target population, starting with these basic things. And on each one, we ask you, you can say yes or no. And if you don't know, please say no. Yes, you're not being graded. There is no judgment that is going to be made of you because you do not know. You may want to think about, well, if I don't know what the size of the population is, does that matter for me? Is that important? Perhaps I should find that information. But in order to complete the action plan, which you are doing to support yourself with your goal, you can go through it, put the information that that you have available or can find before the deadline on the 20th of May in order to complete the questionnaire. So you can see there's a number of questions, and as you consider each indicator, ask yourself, do I need to know this? If I know this, is it going to help me to achieve my goal? And if the answer is yes, then it's probably worth going to look for it. If the answer is no, then, and you don't know it, you can say no, but I would question, these are very basic indicators for immunization. Next session we'll have, François has prepared some slides once everyone now that has understood what the exercise is and so on. So next Monday and Tuesday, we'll be saying more about these indicators with slides that François has prepared. But it's really, again, we're asking you these indicators for you. It's part of the situation analysis. It's part of what you need to understand to be able to make progress. François, over to you for initial comments and questions and feedback, and then we'll open up. Please raise your hand if you have a specific experience relevant that will help Hawwa Buhari. We'll go to you after we've heard from François.
Thank you, Reda, and thank you, Hawwa, for sharing your experience of the plan of action. I think it's I can help to think that you put your finger on a very important issue, which was to use the data you have in your system to figure out, how many of the 0 dose I have. Where are they? And then you said that in your action, you're going to look at why the 0 dose, which means, is it an issue of access? Is it an issue of utilization of the service you offered? And I think you highlighted an important issue as well, which that access is an issue as much in urban area than in rural areas. Now, you've done a situation analysis, I suppose, before. And my question would have been, have you figured out what was the key reasons for having a certain number of dropouts? Did you already know, or in terms of delivery of services and utilization? And is your question on understanding the 0 dose going to further refine your analyzing, looking at the root cause? So do you have the main cause for the 0 dose currently known through your previous situation analysis? That's my question. Thank you.
Hawwa, so the question for you is, did you find the root cause in your situation analysis? What did you find, and how have you used that to design to develop your action plan? Asking you to unmute, as I see.
Okay. Hello.
Yes, we can hear you.
Okay. Actually, based on the situation analysis, that's what we found out, that in urban centers, the major issues the reason why we have the 0 dose was had to do with gender-related barriers. So that's why that was what brought in the idea now of let's have a line list of these zero dose families or children, and then if the intervention is actually going to target directly to those families instead of taking a broader community, taking it on a broader community level. So yes, based on the situation analysis, we adopted that. Then furthermore, we wanted to know if there were other reasons that were as high as the gender-related barriers. That's why we're now conducting the FGDs to further probe further and find more root cause to it.
Nice. Yeah, thank you for that. How are you going? Who is going to do the work in practice to line list the zero dose? Do you have a structure, a human resource structure, to list the zero dose in rural areas or in urban areas? Or do you need to create the structure?
Okay. We already have a structure on ground who we work with. We work with the volunteer community mobilizers that we have on a yearly basis. They have this exercise we carry on, which we call the micro census, which we do at the beginning of the year. For each settlement that the community mobilizer covers, she has a line list of children and households. In those households, she identifies the under 5, the under 1, and then the pregnant women in her settlement. So with this, we can easily track which of the families are zero dose or which of the children are zero dose. So now what we do is that we have them both in the urban and rural areas, just not in all communities.
And are you aware if the outreach sessions are reaching those communities, or it's still something to look for, to find if outreach are regularly organized in those communities? Is it an access issue too, or is this purely a non-utilization of service offered that you're going to find reasons with your first action?
Yeah, we have actually outreaches. In fact, the state have scaled up the number of outreaches and facilities conducting the outreaches across communities. But just because, mostly because of the gender barrier, you can find an outreach post in a community, which is right in front of a person's house or maybe a community leader's house. But the people living across from the community leader would not come out to access those services. Why? Because at that point where the outreach is being conducted, they might tell you that more probably their husbands are not around, so they cannot give them permissions to do that. But if we have this, our volunteer mobilizers are with the outreach service, they actually have the liberty of going into the households, communicating with the caregivers and possibly taking out the children and bringing them to the outreach post. Which, if we continue doing that, it's still not going to solve the problem whereby we need the mothers to actually bring out their children. It's not on every outreach phase you find that the community mobilizer has to go pick the child and bring the child to the vaccination post. So we want them to create that habit of bringing their children to the vaccination post by themselves.
Thank you very much.
The issue of outreach isn't a problem. Really.
Thank you, and over to the others to share their experience.
Thank you, François and Hawwa. So Hawwa, please keep your microphone unmuted so we can come back to you. I see 2 hands raised, so please only raise your hand if you have specific experience, things that you've actually done yourself that could help Hawwa Buhari with her action plan, with her challenge. So I see 2 hands raised. Let's go to Dan. I think Atahir has had his hand up for a long time, and then we'll go to Daniel Kwesi from Ghana. Atahir, a warm welcome to you.
Thank you, Reda and the team. I think Hawwa is doing a great job. We are doing similar things in a different location with her. What she needs to do now is...
Atahir, can you please introduce yourself? Tell us who you are, what you do, where you work.
Sorry, Atahir Abubakar is my name. I'm supporting Zamfara State Primary Healthcare Board on routine immunization. as an independent consultant supporting the state. Currently, we are supporting routine immunization in hard-to-reach areas, those that have security challenges. If you could remember, in northwestern Nigeria, especially Sokoto and Zamfara axis, the issue of banditry have moved a lot of societies and communities away from their normal residential areas. So they moved to some hard-to-reach areas. So that's where we are working now. So what Hawwa need to do in enumerating some of our targets in Sokoto, where I know that they have similar challenge with Zamfara, she should try and involve the security personnel seriously, because nowadays some of the security personnel have been trained to support immunization. So should liaise with them so that she can be safe in conducting her activity. That's one of the major things I want her to look at that. Thank you, Reda.
Thank you, Atahir. Over to Daniel.
Daniel.
I'm asking Daniel to unmute. You may be having connectivity issues, so let's go. Let's go to the next person. I see Barisa Mohammed. You have unmuted. Is it because you have specific experience that will help, in your opinion, Hawwa Buhari?
Hello.
Yes, Daniel. Okay.
Thank you very much, Reda and François. It has been a great experience over the period. I'm from Daniel Kwesi Kwam, and I've been with the IA2030 movement since March, and it has really been an interesting journey, considering the extent of work we have done collectively as movement members. And to me, that is one of the key things I have learned over the years, that teamwork really works, and it has shown in this our work over the period that it has really worked. Because working together for this period, almost 6-7 weeks now, I have realized that there are a lot of innovations, practices, and ideas that all over the world people are having, and coming together has really helped all of us synergistically. So that is one of the key things I want to say, that if you're on this platform, make sure you really connect, be on the Telegram page, learn from each other, and I think it will help. And basically, I am Daniel Kwesi Kwam from Ghana, specifically in the northern part of the country, Upper West region, and working at the regional hospital as a specialist clinical pharmacist and the head of pharmaceutical services.
Daniel, thank you. Thank you for this introduction. Yes, can you share the specific experience that you feel would help Hawwa Buhari with her action plan, please?
Yes, what I can say is that for me, what I think it has helped me, I actually finished my action plan by 1 a.m. Let me say 3 a.m. Geneva time. That will be 1 a.m. Ghana time. That is on the 10th of May. So I realized that what could help Hawwa here is that he has taken a very good challenge. He should go back and gather his data very well, because for me, I started gathering the data. So when I sat down working on the action plan, I have all the data where I have kept them over the period. So it's a matter of taking them and putting them in the question. So if you have your data very well, you realize that your action plan will flow smoothly. So I think you should look at his data again. That will help her to handle the
Daniel,
action plan very well. That is what I want to do.
I'm going to stop you to say two things. One is, of course, we truly appreciate your commitment in the movement. You're part of a group who have become the leaders of the movement for IA 2030. We appreciate your participation and contribution. In this case, however, this is not about giving advice to Hawwa Buhari, but sharing what you have done that you think could help her. Just as you said, you've learned a lot from the experiences and practices of others. So
Okay.
I've made the call. I do not see any additional hands raised. So please, I know many of you are concerned by the zero dose challenge. Many of you
I thought that what I have done is that, of which I can share now, is that my action plan, the challenge I have is hesitancy and refusal of COVID-19 vaccination of some people in one municipality, even though vaccines are available. And in one sentence, is how to summarize it. I said, my challenge is hesitancy and refusal of COVID-19 vaccination of some people in one municipality, even though vaccines are available. And I would like to develop an action plan to improve on the uptake of COVID-19 vaccination. Then what I chose is the priority area is SP3, coverage and equity. And under it, the focus area is barriers to vaccination. And the related challenge is on COVID-19 vaccination. The challenge is purely related to COVID-19 vaccination. And how do I define my action, the goal of my action plan? And the goal I defined was to improve on COVID-19 vaccination from 24% of population of Hawwa municipality fully vaccinated out of the eligible target population by the end of December 2021 to at least 50% by the end of the project in June 2022. We know we are ending somewhere 16 June. So since I started working on this situation analysis, I am focusing on this very priority challenge that I have, that I'll be able to work over the period to move it from 24% to at least 50% of those who are fully immunized.
Daniela, I'm going to have to stop you because I appreciate, again, the clarity of the action plan you're describing, but our purpose here is because we have already heard one person who shared their action plan is to share specific experience. So as your challenge is quite different, I'm going to thank you for your contribution, but we're going to go now to Syed Mehraban Shah Syed. Syed, I just accidentally muted you when I meant to unmute you. Yes. So please remind us who you are, what you do, where you work, and then please share the specific your experience, that something you have actually done that you feel could help Hawwa Buhari with her challenge and her action plan.
Thank you, Reda. This is Dr. Syed Mehraban Shah from Afghanistan, the technical officer of W2 country office. Actually, I joined later, and so I don't know what Buhari was on which topic he.
All right.
What is the challenge?
All right, Syed. Well, thank you for raising your hand. In that case, we're going to. All right. So I'm going to. We're going to make one final call. We actually skipped the 30-minute mark where we have a ritual where we ask if we, if those of you in the room wish to continue. So please raise your hand. If I know many of you are working in your action plans or in your situation analysis, you have worked on and thought through the question of zero dose. So, but the point of the experience sharing, of course, is is dependent on your willingness to raise your hand and share. So I suggest we bring this, as I do not see any other hands raised from people who have specific experience that could help Hawwa. I am sorry for Hawwa because she shared, with great detail what she has put into her action plan. So it would be sad to leave. I would be sad to leave without specific experience from those of you who are in the room that will be helpful to her. But that is in the hands of you as members of the movement. if we bring this, we're going to bring this to a close here. Yeah. So one final call to share experience, and I realize, yeah, many of you joined after the start time, so I would encourage you, out of respect for your colleagues, understanding that many of you have challenges and work priorities, but really encouraging you to make the effort so you can hear the full story that is being shared in order to then be able to share your experience. So, all right, so we'll go to François for closing comments, and then one word from Hawwa Buhari, just to ask you, after we've heard from François, what would have been helpful to you from your colleagues, fellow members in the movement? But first, François.
Thank you, Reda. Thank you, Hawwa, for sharing your challenge, and they are very concrete. You have identified the real challenge. Your situation, I think I'm glad to hear from you that your situation analysis has a certain number of zero dose, and you have already identified some reasons for it. And I was happy to see that you're going to, in your action, you're going to try to find even more detailed root cause analysis why people, when outreach are organized, that the people are not coming for immunization through your community network. And I think this is a very great purpose in your plan, and I hope you succeed in that. Yeah, I was glad to see that in your action, you decide to line list those people, those zero dose with your existing network that will enable you to focus on zero dose. And one thing that I would say you have raised that you realize, and it's very important, that your data is very important for you to figure out, I suppose, where you're going to prioritize to prioritize your efforts, where you have the maximum number of zero dose. It's very difficult to go everywhere when we have limited human resources and financial resources. And this prioritization is going to be extremely important. And I would say that you have already identified a gender issue that is partly responsible and you're going to address. I think following up will be with the data that you mentioned that you realize are extremely important to follow up your activities. So thank you, Hawwa, again for sharing your experience. Wish you a success. Thank you.
And
Thank
Hawwa,
you so much, François.
Thank you. Hawwa, I do think we have an issue with many people arriving late in today's session, too late to fully hear your story. I apologize for that, and would ask members of the movement, of course, for the first decision you have to make is if you want to come to share your experience. And the second effort that you need to make, is to actually, in order to be considerate towards your colleagues and what they're sharing, is to try to do your best to be on time. Hawwa, what would you have liked? What would have been helpful to you in terms of experience being shared from your colleagues?
I was actually really hopeful that I might get some of the ideas or maybe innovations, especially using the gender response to address some of the issues I have. Because here we have one or two interventions using the gender, being to be gender specific and all that. But I would love to hear my colleagues, either from Nigerian based or around the world, to give me some more inputs on how to go about it. But it's okay. I would go through the idea and just and get some more.
Okay, thank you, Hawwa Buhari. And we are working, Hawwa, you were probably amongst the contributors to the zero dose session that we did, or were in attendance, and there will be a follow-up, so we will be able to hopefully share more of the experience around zero dose, because there is a lot of, even though there are different understandings and framings and so on, I do think we should be able to help you. I regret that this time around, members of the movement, even those who wanted to, yes, we're quite willing to. Unfortunately, we're not able to. But that is part of a movement that is alive, that is busy professionals trying to reconcile, trying to find time and make time to share experience and to try new ways of doing things and to learn from each other. So there is no judgment towards the participants this time, but a little bit regretful, and ask everyone, you're making such a great effort to participate, to contribute, to develop your action plan. And I think that mutual respect and consideration for each other are really, really, really important, and appreciate the very respectful and supportive ways in which everyone has been participating. So thank you very much, Hawwa and Buhari, and all of you who were able to join the session. Wishing you all well. And so just to clarify, once you have submitted your action plan, that's it. You're done with this activity. You have your action plan, but you should be thinking about the next question that we're going to ask you is, are you ready for action? And if you decide to work on implementation of your action plan, that will start on the 23rd of May. In Monday's assembly, I'm going to, we are going to hear from people who have completed their action plans. We'll be asking some of the participants whose action plans are truly excellent to step up and tell us about them, sort of show what a good action plan looks like, and then discuss the next steps. But also, we're going to launch a remote coffee. So this is the activity in which you will be connected with someone else in the movement, and you will be able to connect and have a chat with that person, discuss your action plans, discuss your work, discuss, of course, it's a professional context, so professional discussion about other areas that are of significant interest to you. So that's the plan for Monday's assembly. What I would ask is, as I did last time, for those of you who were in attendance on Tuesday, is to go to the Telegram group. So I will share the link here. And again, so let me just get the link. So go to the Telegram group and and share what you learned in today's session. We want to, not everyone can be in these sessions, obviously. These are intended to be small group sessions. So if you take time to share a little bit of what something interesting that you heard, something that was helpful for you, do share it in the Telegram group to encourage others to understand why these sessions are worth attending. And again, I know many of you are facing so many challenges in your daily work, so appreciate everyone's participation. Thank you. I will now unmute everyone so we can actually hear you and we can say goodbye to each other. Thank you once again to Hawwa.
Thank you, Reda.
Thank you so much.
Thank you, Reda. Thank you, everybody.
Thank you. Thank you, François.
Thank you, François. Thank you, Reda sir.
Though I couldn't join early, it's fun.
Hello. Thank you, Mr. Reda. Thank you, Mr. Reda.
Thank you.
Thank you very much.
Thank you.
François.
Thank you.